quite an experience to live in fear, isn't it? That's what it is to be a slave.
And welcome back. Moving on, we're going to be talking now about anemia of chronic disease. Anemia of chronic disease is probably the most common type of anemia in hospitalized patients in the US. It is characterized by impaired red cell production. It is associated with chronic infections like osteomyelitis, chronic immune disorders like rheumatoid arthritis, and neoplasms like lung cancer. The pathogenesis has to do with hepcidin, the little protein we talked about a few days back that inhibits ferroportin production. It turns out that hepcidin inhibits not only the ferroportin in intestinal cells, trapping the iron inside the cell, but also the ferroportin in macrophages, making it hard to get the iron out of the storage pools so it can go to red cell precursors. In anemia of chronic disease, there are lots of inflammatory mediators present, as you can imagine. One of them, interleukin-6, stimulates the liver to produce hepcidin, which means that even though there is enough iron around, you can see it in iron stains of the bone marrow. It can't get out of storage and into red cell precursors. How strange that the red cells are starving for iron when they are sitting right next to it. Hepcidin may also suppress erythropoietin production, slowing the production of red cells. Why would the body do this? Maybe it's because in some cases it's beneficial to keep the iron inside macrophages rather than letting it out into the system. Some bacteria, for example, require iron, so it makes sense to keep the iron behind locked doors while you're trying to fend the bacteria off. To read more, check out Robbins' 9th edition, page 652.